Have you ever heard of a silent bacteria that lives in the stomach of more than half of the world's population and, over the years, can trigger a ticking time bomb inside your body? This bacteria is called Helicobacter pylori, or simply H. pylori. It's a survivor, resilient, adaptable, and once it settles in the stomach, it usually doesn't let you know it's there. And it's exactly this silence that makes it so dangerous. It hides, inflames, corrodes, and if left untreated, it can open the door to something much more serious: stomach cancer. In this video, you'll learn exactly how it works, how to identify the signs, how the diagnosis is made, and most importantly, why ignoring it could be a deadly mistake. Stick with me until the end, because what you're about to learn today might completely change the way you care for your digestive health. More before, already leave your like. The more likes, the more YouTube shows this alert for those who need to see, and please share this video with your friends and family, and subscribe to the channel if you are not yet subscribed. H. pylori is a spiral-shaped bacteria with a unique characteristic. It can survive in the extremely acidic environment of the human stomach. While most bacteria die in that acidity, H. pylori produces an enzyme called urease, which neutralizes the acid around it, creating a kind of protective shield. This allows it to attach to the stomach lining and begin causing inflammation. But this inflammation doesn't show up overnight. It's silent, chronic, and accumulates over the years. The bacteria damages the protective lining of the stomach, allowing stomach acid to attack the tissue directly. It's as if, little by little, your own body is being sabotaged from the inside without you even realizing it. And that's where the real danger lies. Over time, the constant inflammation caused by H. pylori can evolve into atrophic gastritis, a condition where stomach cells begin to die or transform. This process can trigger precancerous changes in the gastric lining, such as intestinal metaplasia and dysplasia. If nothing is done, these cellular changes can progress into gastric cancer. And the scariest part is that this can take years to develop, which gives people a false sense of security. After all, if it doesn't hurt or bother you, why worry? It's exactly that lack of obvious symptoms that causes many people to discover the problem only when it's already in an advanced stage. At that point, treatment becomes far more complicated, and the chances of a cure drop significantly. But how does this bacteria get into our stomach in the first place? H. pylori is mainly transmitted through oral contact, meaning it can spread via saliva, contaminated food, or water. In many parts of the world, especially where sanitation infrastructure is lacking, infection is extremely common, often occurring during childhood. And once it's inside the body, H. pylori can remain there for decades if left untreated. It doesn't take much for it to settle in, just a small failure in your body's defense system, and it begins its silent journey. So the big question is, how can you tell if you're living with this invisible enemy? The symptoms of H. pylori infection can be so subtle that they go unnoticed for years. Some people report stomach pain or burning, especially when they're hungry. Others experience nausea, bloating, loss of appetite, or even unexplained weight loss. In more severe cases, there may be blood in the stool or vomiting blood, signs of advanced ulcers. But the most concerning fact is that many people show no symptoms at all. That's why early diagnosis is critical. Waiting for signs to appear can be far too risky. The good news is, there are effective ways to detect H. pylori in your body, even when it's working in silence. Diagnosis can be done fairly easily. One of the most common tests is the breath test, where the patient swallows a substance and, after a few minutes, blows into a bag. If the enzyme urease, produced by H. pylori, is present, the test comes back positive. In addition, blood tests, stool tests, and endoscopy with biopsy may be recommended depending on the clinical case. Endoscopy, although more invasive, allows for direct observation of the stomach lining and sample collection for analysis. It's the most precise way to check for inflammation, cellular changes, or even early signs of cancer. And the earlier this is done, the greater the chances of avoiding serious complications. Treatment for H. pylori involves a combination of antibiotics to kill the bacteria and medications to reduce stomach acidity. This combination is essential because lowering the acidity allows the antibiotics to work more effectively. The treatment typically lasts 7 to 14 days, and success depends heavily on the patient's adherence. Stopping treatment early or taking medications incorrectly can allow the bacteria to survive and become even more resistant. And remember, treating it isn't just about eliminating symptoms, it's about preventing long-term complications, including cancer. So, following your doctor's instructions properly is a crucial step in this battle. Preventing H. pylori infection is also possible, mainly through simple but effective hygiene habits. Washing your hands before eating, avoiding raw or poorly washed foods, drinking clean water, and making sure your food is prepared in sanitary conditions all make a big difference. And, of course, paying attention to your body's signals. That annoying stomach ache, constant nausea, or discomfort that just won't go away, none of that should be ignored. Your body speaks, and often, it's trying to warn you about something very serious going on behind the scenes. Now that you understand how H. pylori can become a real risk for cancer, the most important thing is to take action. Regular checkups, talking to a doctor if you notice any persistent symptoms, and maintaining healthy habits are decisions that can literally save your life. And if you know someone who constantly complains about stomach pain or has a family history of stomach cancer, share this video. Sometimes, a simple piece of information can be the turning point for a longer and healthier life. H. pylori is sneaky, but with the right information, prevention, and proper treatment, you can defeat this threat before it ever causes real damage. Taking care of your stomach is taking care of your future.